Medical advancements made in the last century have certainly changed. Some surgeries are no longer conducted the same way. And here with more insight on surgical advancements there at Gibson Area Hospital, we have Dr. Dragu joining us. Welcome.
Thank you for having me.
Let's talk about interventional radiology and what exactly that means and what it covers.
Yes, thank you for having me here. I'm honored and it's a pleasure to be here. Interventional radiology is a special field of medicine that utilizes imaging to perform minimally invasive procedures to treat a wide variety of conditions, utilizing imaging, which can be in a form of ultrasound, live X-rays such as fluoroscopy, CT scanners, or even MRI to treat a variety of conditions that once upon a time they were performed by surgeons, and a few other extra procedures that now we perform using minimal invasion to treat a wide variety of patients.
Well, yeah, and I'm thinking if it's minimally invasive, that's going to be quicker recovery time. It could possibly be an in and out, like patient type surgery.
Absolutely, that is true. I also would like to explain a little bit about different procedures that we do. In fact, yes, the recovery can be very quick for some of the patients that we treat, because interventional radiology deals with mild diseases, but also with very, very serious and much sicker patients. So the simplicity of the procedure can be such as a biopsy or another quick procedure where the patient walks in the hospital and then within the same day is discharged, basically a walking patient, but also much sicker patients, somebody with trauma or bleeding, to stop the bleeding, or possibly treat patient with cancer or heart problems, so basically very, very sick patients. So we treat a wide spectrum of conditions, again, utilizing imaging modalities to treat these patients.
Let's talk pain management, because a lot of people have the back pain or just the aches and pains of everyday life. You have procedures that would help for that, and maybe so that it wouldn't be so invasive if they waited, or it'd make things easier.
Right.
Handling pain.
Yes, so a big portion of interventional radiology is in fact pain management, like you alluded, and the pain obviously can arise from a variety of different conditions, and we treat specific types of pains. First of all, we evaluate the patient. We do have a clinic at the Gibson Area Hospital, as well as obviously state-of-the-art imaging and procedure room, and we evaluate whether the patient would be a good candidate for that particular procedure. Some of the pain syndromes that we treat are back pain. It's very, very common, starting from neck pain, back pain, joint pain such as shoulder pain, knee pain, hip pain. And I will actually talk more specifically about the leg pain, but these syndromes can be treated sometimes with rehabilitation or therapy, sometimes with a pill, sometimes with a procedure that I would perform or an interventional radiologist would perform, and sometimes it's surgery. But we could sometimes treat the patients very well using the techniques that we have available, such as back pain, for example. And usually they respond very well to the type of the procedures that we perform. Also, in addition to pain management, unfortunately, some patients may have fractures of the back, and we actually can fix those as well, utilizing the imaging. And again, when I say minimally invasive, I really mean it. It's basically done through the tip of a needle without having to cut the patient.
That sounds like a great route to go when it comes to that kind of surgery.
Correct. And again, sometimes patient may need surgery ultimately, and we provide the evaluation and obviously direct them through the correct channels to provide the best patient care possible.
Well, and you can get that best care possible at Gibson Area Hospital with Dr. Dragu. We appreciate your time and being with us today. That's great information. So,
thank you.
People have some pain. Maybe they are in need of some type of procedure, or you just have some questions and you want to learn more. There's a look at the Gibson Area Hospital website, which we will connect you with after today's show.